People have been collecting information from bats, and to see that with all the diversified viruses, there's still not a single one that contains the 4 amino acids as what we see in the COVID-19, the COVID-19 virus.
So what you're saying is if it was naturally occurring, we should see those 4 amino acids.
Right. Well, not we should. If we saw that, then we would be very confident and say it's possible. But up to now, with all these virus sequences that we still haven't seen it, it's possible that it's made in the lab and sort of a accidental leakage, from the lab.
Could you explain to us how investigators can now determine whether, or hope to determine, whether it was from a lab or natural? What sort of things do they need to look at?
Of course, it requires the collaboration of the Chinese government to allow outsiders to go in, or alternatively, it would be like the whistleblower from the inside. But I think given the situation in China, the whistleblower is probably much less likely at this moment. So basically the government, Chinese government, would have to agree to review and investigation of their laboratories. Yeah.
Some scientists have said that a lot of that information that they need is probably destroyed or needed to be captured much closer to that time.
It's possible to destroy, the laboratory record, but in a proper manner, the laboratory records are written and recorded with the lab notes. That's pre-existing page and dates and everything. So if they are unable to provide, the laboratory notes from some years ago or from the recent years to show that the kind of work they have done, or they destroyed it, then
so it would be very obvious that had happened, that there was something missing.
I think the Chinese government seemed to be able to do a lot of things, and I just cannot imagine, because they were required, sort of large number of people to lie, not to tell the truth at the same time. For us living in the free world, we would think it's not likely, but maybe it's not so unlikely in a situation where people are oppressed, So.
And so from your research and your work, what awareness did you have of the Wuhan Institute for Virology and the sort of work that they're carrying out?
They have been conducting some gain or loss of the function. The so-called gain or loss of the function of the virus, meaning you insert a piece of gene that with no function into the virus. Theoretically, it's possible that they have done it, but we have currently no evidence to show it.
So recently, China declared the end of the epidemic in China. Does this mark a watershed moment for the pandemic for the world?
Although we have no precise numbers of their confirmed cases, etc., but from the report from the news and the natural conditions, with the warming of the climate and or the weather, it's possible it's ended. But it doesn't mean the high-risk people are free from future infection and future threat. Yeah.
But what happened to, at the end of last year, the beginning of 2023 this year, there was real fears, concerns about, 3 waves of outbreaks in China, as a result of them opening up. And what happened to all that?
Well, the fear of that is because even though the Omicron, the very latest variants are named Omicron, large numbers of them, they are very low pathogenic, but because the rapid transmission of it, so in a short time, the unit of time, large number of people will be infected. So even with very, very low proportion of the people who would acquire severe diseases, that might still collapse the healthcare systems.
There have been predictions of 2 million, sometimes 3 million deaths. So that was overblown?
Well, China, the number of deaths, annual death, is more than 10 million. So if you divide it by 12 months, you have about a base level is nearly 1 million. So to say that 1 million additional deaths in the running in the course of maybe 3-4 months may not give too much of alarm.
So you mentioned excess deaths.
So these excess deaths, you really have to count it to know. But during the colder days, that December, November, January, indeed they were showing lining up in the funeral homes that were lots of coughings or etc. So maybe there were increased the number of deaths, but some of them may not be due to COVID, because in the winter there is always been more death than in the summer in the temporal region. So that's always the patterns.
And what's your view on vaccines? Most people have had 3 here in Taiwan, but then there are some people, and maybe in different countries, who have had 4, 5, and then the manufacturer, the pharmaceuticals, have released, maybe we can call them patches, so specific to certain strands of COVID-19. What's your view on that? Should we be taking these?
Specifically, some small proportion of the people, they are unable to mount a good immunological response. Then each infection, each reinfection would cause more damage to them, to their health. We are very certain that great majority of the population, infection provides protection in the future against severe disease or death. But in a small proportion of the people who have underlying disease, who are unable to mount a good immunological response, would have severe disease with each reinfection. So that's the situation. Yeah.
And is that any different to influenza?
By and large, it's pretty much the same. We are seeing people, older individuals, who are unable to mount to antibody response. And so despite receiving the vaccine, they still get infected and then die of pneumonia, etc. So, but influenza, we did not go into this kind of details, because it's a century-old disease to us, and information collected is in a different situation. But I would imagine it's very similar. Yeah.
So it's interesting that you talked about kind of COVID being under the microscope, because of it happening, in our present day, because it was a pandemic that reached every corner of the world.
And we have the technology to study it from different aspects. Yeah.
How well prepared do you think Taiwan was for this pandemic? Obviously, we talked a lot about the SARS outbreak earlier, which helped to, prepare Taiwan a lot more than other countries across the world.
The word preparedness, I might say, because of the SARS experience, we learned it's important to have the border control, because we are island country. From this COVID experience, we could see several island countries, Taiwan, New Zealand, and Australia, they have really done quite well from the initial waves. But how well we were prepared to deal with the COVID-19 face to face? Well, as you could see, the situation became chaotic from time to time. Normally, there is no country would have such health capacity to deal with it. So one would have to fill it out, triage people, and to have places to separate them out and put the sick people in the hospital. So it took us some time to get it all sorted out. So fortunately, we were very diligent in watching what happened in other countries and quickly establish our system. To say we were very well prepared, I think, I cannot really say that, but we quickly, caught up.
And where would you mentioned some of the weaknesses. For you, what weaknesses need to be fixed as a priority?
Well, I must say, looking at the morbidity and mortality, we've done quite well. But looking at the research, data information, data, the transparency of analyzed data. Although every day we heard numbers, but that's just raw data. It's just like you see the trees, but you don't see the forest, something like that. So I think in the future, we need to have, you see, for new emerged infectious disease, research is as important as control of the disease, because without proper information, without collecting precise information to understand the infection and the virus, it's very hard for us to have a good control. But fortunately, we were behind, so we collected information from outside. But in the future, we might be the first country to have a new virus or a new pathogen to emerge in this country. Then we would be quite unprepared in such a way. We should have a team that analyzes the data. I think the British done so well in terms of their data collection, analysis, and making it available to everybody. We just go on to see their report on a weekly basis. So that is the sort of system we need to establish in our country.
Where do you think the next pandemic will come from? Will it come from China, Africa?
It's hard to say. It is hard to say, but
is the world doing enough to prepare for that collectively?
For this pandemic, I thought we had done so well because during the Ebola virus outbreak in Africa, a lot of people have begun to work on the vaccine and etc. So, we thought it was quick enough, but still not enough. You see, Wuhan shutdown was when? Was January the 24th. On the January 23rd,
2020.
Right, 2020, yeah. Already an organization called SAPI, that's sort of a vaccine research sort of grant provider, I should say that, already signed contract with 3 institutes or vaccine providers, manufacturers for them to conduct research. And in our country, even before that, we already collect information. Some of our manufacturers already sent out order to begin vaccine research. So we thought we had done it so early, so fast, but still not enough. I think for newly emerged infectious disease, the important part is the initial search. One should be very diligent, vigilant in terms of investigating the source, the pathogen, what they are, and the source of it, and make it transparent. If any difficulty, with international collaboration, and that would allow us to all work it together. In both 2003 and COVID-19, we experienced the delay of reporting, the delay of whatever. And all looking back, it all something to do with their political system that just suppress the healthcare workers to disclose the information. So there's something in their system.
From the outside, when people observed Taiwan's model and China's model, they said that it was obvious that China is following zero COVID. And however, there seems to be similar traits with Taiwan's model. Initially,
yes. Zero COVID is obviously the way to go before we had the drug, we had the vaccine available. But once the vaccine and the drug became available, one would have to begin to evaluate how to proceed forward, especially in the year 2022, we saw the emerge of Omicron, and it's low pathogenic, it's high, sort of very rapid transmission, or just wipe through your population really quickly. Then you have to make your decision. And one other important thing is that no matter how good the vaccine, at that time, the available vaccine protection rate against infection was only 70%. When one first received it, at the most optimal time. and every month it passed, it dropped 10% of the protection rate. So given this information, you would have to calculate your population, how rapid to immunize your people, and what would be the optimum time for you to quickly sort of open it up to allow the virus to transmit. Because there is no way a total protection by vaccine. The sum of the protection will have to come from natural infection, and you have to allow people at their optimal immunological response, after the vaccine, for them to expose to the virus. So that's the calculation. I think China missed that opportunity. Taiwan, it seems, was going to miss it, but all the scientists would not allow. We put a lot of pressure on the government.
And so the government had wanted to play much safer than what the science said.
I must say, some doctors, I've talked to some doctors. I was wanting to derive some consensus about it, and I tried to speak to them, say, can we have some consensus? They said, we have no consensus with you. We want to keep it zero. So I thought that was just too difficult. But fortunately, I think the outbreak occurred, and then the government realized it was too difficult to continue maintaining zero COVID, so just opened it up at the proper time.
I want to end on one final question. What is your view of wet markets?
It has to be stopped. One has to look at it from food safety's point of view. Wet market in Taiwan, apparently, we banned it in 1913 or 14. It was H7 and 9 period. When I saw this,
and those are the avian flu,
H7 and 9 avian flu. So I saw what happened in Shanghai. I advised our government to have the law, and I was told the law had been there, but they were not able to implement it. So I said, do it this time. So it was done, and so one must say, Taiwan and China share some similar culture, and if it can be possible in Taiwan, it should be done in China.
Absolutely. If a democratic country can do it, then surely an authoritarian country can achieve that.
Sure.
Dr. Mei-shang, thank you so much for joining Taiwan Talks today.
Thank you.